If you only have one embryo left and all your hopes are in that one embryo, obviously it's super frustrating, concerning. It's devastating to a lot of people. And sometimes your physician may not even care. They might be just saying, transfer the embryo. Let's see what happens. No special treatment, no test. Is that right for you? Well, sometimes there's stuff you can do, especially testing or treatments to maximize your success rate. So if you want to find those out, listen to this video. The first thing we would look at is testing for the genetics of the embryo. Now, if you've done PGT and you already know that your embryo is genetically normal, you can check that off and you don't have to worry about it anymore. But if you haven't done it, I don't recommend thawing the embryo to biopsy it at that point. Why? Because there are studies that support the fact that that decreases your success rate. There is new AI technology that can be used. We now have it at our clinic, where you can actually look at time-lapse images of the embryos as they were growing if it was done in a time-lapse incubator, and that gives you a prediction of whether or not the embryo is normal. Is it perfect? No, but at least you'll have a sense of whether you're dealing with a genetically normal or abnormal embryo, because you don't want to be putting all your hopes in one basket if that basket isn't really worth putting all your hopes. The next thing we would look at is whether or not we've optimized you. So the protocol that you use is critical. Most people are getting estrogen and then progesterone and then having their embryo transfer. And a lot of people aren't even getting their progesterone levels checked. We now know from many, many studies that that gives you your lowest chance of success and your highest rate of miscarriage. Estrogen-based protocols or hormone replacement therapy protocols have the lowest potential for delivering you a baby and the highest risk for miscarriage. What should you be doing? You should be using a letrozole-based protocol. Letrozole keeps your estrogen levels lower, gives you a much more natural approach to things, way less inflammation, way less complications in the pregnancy, and you get a much better outcome at the end with the lowest chance of miscarriage instead of the highest chance of miscarriage. So doing anything else is a complete error in my opinion. You should be sticking with that letrozole protocol. The next thing that we would look at is, are there any infectious or immunological problems that might prevent you from succeeding? So you can get testing done in a variety of different places. We use Fertility, which is a company out of Greece. They will check you for infections in your uterus or imbalances in your vaginal and uterine microbiome. And on top of that, they'll do an immunological assessment to see if A, your immune system is over-aggressive, and B, are you reacting negatively to your partner? Because some people do. In those circumstances, there's a whole variety of things we can use to optimize your success. If your microbiome is out of whack, we can fix it. We give you antibiotics, we give you probiotics, we stabilize the lining, and that way you have a much more embryo-friendly environment. If you have immunological concerns, it very much depends on what's wrong. Sometimes it's something simple, take some steroids, take some anti-inflammatories. Sometimes you need complicated therapy like leukocyte immunization therapy or subcutaneous or IVIG. But these can make the difference. I just got a message from a patient today on Instagram who told me after 9 years of trying, they finally succeeded and got pregnant naturally without even having to do IVF, just after they did LIT therapy with us in preparation for doing an embryo transfer with their home clinic. So these are things that we can look at and try for you that will drastically improve your success rates.